Hi friends, this is Veena from VPM Pages. Welcome to my show, Spark Talk with VPM. Today we have Dr. Partha Das, who is a Deputy Medical Director at Orchid Fertility Clinic and is also a highly skilled consultant for reproductive endocrinology and infertility, or IVF. He has done MBBS in medicine and surgery, MS in obstetrics and gynecology, and MSc in assisted reproduction embryology and genetics from University of Valencia, Spain. He has received many awards and certificates for his outstanding work, which will be discussed later. Wow, that's really nice to know. And during his free time, he also loves gardening and cooking. So, welcome to my show, Doctor, and thank you for taking your precious time from your busy schedule. So, could you please brief us about yourself, about your career, about your work?
Thank you, Veena, so much for this platform and for your time, and to invite me for this live show and talk about our kind of work that we do. So yes, I'm Dr. Partha Das, and as Ms. Veena has pointed out, I'm a full-time consultant, fertility IVF doctor, working in Dubai Healthcare City in Orchid Fertility Center. I'm the deputy medical director also in this clinic. I started my journey in the fertility practice that I do since 2003, and that was from Mumbai in India at Jaslook Hospital. And having been extensively trained, then I got my super specialization trained from University of Kiel in Germany, and then my higher advanced training from University of Iowa in the United States of America. And after that, I bagged the master's in assisted reproduction genetics and embryology from the University of Valencia, Spain. So yes, my professional work has been in the United Arab Emirates in Dubai since 2006. I've been working in this country and trying to achieve and trying to fulfill the fertility needs of the couples who are trying and planning for a pregnancy and hoping to achieve what they want. Yes, thank you so much again.
Thank you, doctor. And this is very rare profile as compared to other medical fields. So why are you? Why were you so interested to choose this profile as your career?
Well, very good question, and as well as a very tricky and a difficult question. Yes, when we do our graduation studies, we are exposed to a lot of subjects of medicine, surgery, pediatrics, OB/GYN, and so on and so forth. But somehow, when you read all the subjects, you feel an inclination towards particular subjects which interests you. And specifically, as we had started working towards this field, I found this miracle thing of life happening, and it excited me, and which resulted in me doing the master's in that specific subject. And then I had to decide whether I need to be a normal OB/GYN, or I should be doing extensive gynae laparoscopy or oncology, or in vitro fertilization techniques. And then again, I had to fine tune that choice. And my calling was for this subject, which is in vitro fertilization and assisted reproduction. In our branch, we do not end up getting 100 out of 100, means we do not get 100% success rate. So in this regard, when we sit and discuss the fertility needs and the problems of the couples face, and then we try to devise and modulate treatment options, and whoever gets pregnant, the smile, the content that we get to see on their face, and the family, that's something which I think I cannot explain in plain simple words. It's something beyond, and this keeps us going, and this motivates me to do more. And I think, as like my thoughts, other fertility doctors also has the same belief. So yes, this is what is something. Yes, and you rightly said, it is very different from any other branch of medical or surgical practice. this
Exactly.
branch of IVF, or trying to fulfill somebody's family, and advancing the family through scientific technology is amazing. And still we are studying, still we are learning, and every patient teaches us something new today. Yes,
Because it's like you're giving hopes to a couple, like
that's right.
to.
Yes.
And now coming to your profession, what is infertility, and is infertility a male or a female problem?
Well, infertility is a branch of science where we have said that a couple is infertile when they have tried unprotected intercourse for 1 year, and if nothing has happened, means the woman has not got pregnant after 1 year of unprotected intercourse. That's when we say that yes, it is primary infertility. But if somebody has had a baby before and they were trying to have a second child and they were not able to achieve the second child, then it's called secondary infertility. But this duration of 1 year is reduced to 6 months in ladies who are more than 35 years of age. So if somebody is 35 and more than 35 years of age or 40 years of age, and they have been trying for past 6 months and they haven't been able to achieve conception or a pregnancy, then they should immediately seek the help of a doctor and for evaluation and treatment. Yes.
And like since past 1.5 years, we are facing like tough time during this pandemic. Like we hear about many women, they have conceived. So do you agree that busy lifestyle and schedule was one of the reason for infertility?
Well, no, I would not say busy lifestyle or stress causes infertility. Who doesn't have stress? We all have stress. I have stress. You have stress. Everybody has stress. So stress is not the cause for infertility, or infertility is not a cause of stress. Probably it is one of the factors down the lane. So we have to understand that there are a lot of other causes. It could be a problem in the men, where the sperm problem could be less, or it could be an absent sperm, or it could be the problem in the wife, where either there is a problem with the eggs, or the tubes are blocked, or there is some fibroids or polyps in the uterus, or it's a combination of both the factors. So I think in today's day and age, probably because of people are delaying their marriage, people are delaying their childbearing, probably because they wanted to achieve their
The
professional
career they wanted,
goals.
yeah, do good in career.
Good in career. So what they do is they postpone their family bearing practices, and then what happens is, unlike a man, a woman is time bound in the sense that with age the number of eggs keeps on depleting, and that is one message which we all as fertility doctors, we need to put it across to the society, that if if possible, try to get this pregnancy thing get out of the way as soon as possible, because the best solution to this pregnancy is the earlier you do, the much better. The later you wait in your life, the much complicated it's going to be in your fertility journey. So
And
yes.
spending very less time with each other, that's as exactly as you put it across, like they're busy in their career, or they're busy in busy lifestyle, we can put it in that way, busy lifestyle. They're not able to match up the time for towards each other, or all those, like maybe that is also one of the factor that it causes infertility, as you rightly said, like they delay in family planning and all those things, so
Yeah,
planning for
so
their baby.
that's right. So that's what we sometimes and commonly see in our day-to-day clinics and consultations. That they are so stressed in life that the couple are not able to have a normal, time together, and and they are not aware of it. And when they come and talk to us and discuss, and then we try to segregate this patterns of their life and their professional life, and we ask them to have intercourse in the unsafe period of their cycle. Many a time, many of these couples come back saying that thank you so much for that guidance and counseling. We did not need any treatment. We just needed your golden advice, and we are pregnant now. And that is it. A little bit of information, a little bit of guidance, a little bit of education is what it takes.
Sometimes this problems will be sorted out with the counselings also. Like no need of treatment.
Yes, as fertility, physicians, our main job, I think, to keep it at a high, is counseling. We are actually counselors, and where we try to discuss and talk and educate our people. There are a lot of ifs and buts in our treatment, and those needs to be addressed. Yes.
True. I think for that matter, any doctors in that way, they have to be counselors as well, parallelly. I think it happens in your profession, be it whatever.
Yes, because our profession, our profession carries a lot of things in that we have to acknowledge and understand the stress factor, which the couple is carrying, because it's a stress of the personal, achievements. It's a stress of the family. It's a commitment, that they have to, which the family looks upon. So silently, they do not talk much in our community, in the Indian community. People do not talk much about it, and sometimes even the couples do not talk amongst themselves. This is so important. This discussion needs to be done, and we need to tell that it is not a problem. It's not a pathology. It is okay to talk and come out and say that we have this problem and we need a way forward. So yes, this information needs to be passed on.
As you said, like it's not a gender, it's not like female or male, and it's not age. It's actually age also does affect. So, is there any you have handled many cases as of now? So, have you come across you can list it down females are more or males are more like that, because we hear most of the times when a lady is not able to conceive, it would be lady's problem, especially it would be a lady's problem unless until a guy is ready to go for an checkup. So that's when we come to know it can be a guy's problem also. So what do you have to tell, now you're in an open space, so what do you have to tell? It's not a gender, right?
So I think gone are the days when we say that it is the wife's problem or it is the man's problem. I would say it's our problem.
Yes.
I mean, it is a baby comes through a combination of the sperm fusing with the egg, and that's how a baby comes. You cannot have a baby only with an egg or a sperm and all. So it is a combination of both the factors.
It's a combination of partners.
Yes, it's a combination of both, and it's one unit. It's one unit. So there is first of all, there is no blame game to be played here. All right, it is us together. We want to have a baby, and we have to sort this problem in our life and whatever issues we have, and we need to go forward in our life. So we get to see problems in either the lady where the eggs are deficient. And as mentioned before, with the advanced maternal age, there is a decline in ovarian reserve, and that's the commonest, scenario which we usually get to see in our clinic day in and day out. Cysts, fibroids, or in men with low sperm count. So when we see all this, we do not say, oh, it's it is your sperm which is the fault and all. No, we never say that. We say that with all this evaluation and the investigations that we have done, we feel that the next forward path for you would be in the form of an IUI or taking some tablets and trying at home or doing an IVF, and that would give us this much chances of success to achieve a pregnancy. And and we discuss all these points together, and we counsel and educate our couples, and yes, it works good actually.
Okay, I think the audience who are listening and who is going to listen also, please do not, as Dr. rightly said, do not. It's not a blaming game. It's a mutual understanding between partners, between couples who have to work together. Okay, doctor, do every individual have different reason for infertility?
Do every individual have different reasons for infertility? Yes, I mean, yes. I mean, every couple is different and unique. You cannot compare couple A to couple B and then couple B to couple C. Everybody has their own manifestations and varying manifestations of how they present with the whole problem. As I said, it could be a combination of both the factors, male and female factors. It could be either the lady that has got very less eggs, or she has got endometriotic cysts, or fibroids, or polyps, or the tubes are blocked, or it could be the man with low sperm count or no sperm. So yes, it's a spectrum of problems out there which we have to test. We have to do step-by-step analysis, investigate the couple. Not that a couple comes today and straight away we take them for a treatment. No, it doesn't happen like that.
No.
We have to give enough time. We have to first talk, discuss, educate, counsel, do the test, investigate the test, describe the test, what is there, and understand what that test means. And then accordingly, we devise a treatment plan and take it forward. Yes.
So I think people should. It's a vice versa. Like couples should not go and take outside advisors, as well as outsiders or family members shouldn't be giving. Shouldn't compare the same. It cannot be a same problem. So they cannot compare with another person. So I think they should go to a doctor who can guide you and who can give you right suggestion, what treatment and suggestion, what they can do about. So this is one awareness I think we should be giving for all the couples as well as family members. They shouldn't compare one case to another case. So
Yes.
rightly said,
So
doctor.
this is a very important point which you have raised, Veena, that this comparison. Nowadays, in this era of social media, oh my God, there is so much of information out there, and what happens is there are a lot of groups out there. So somebody is saying that I had this one egg, and the other says that I had 3 embryos, and I had this success, and I got pregnant with twins. So what happens is everybody tries to compare and contrast themselves with others. They had this, why not me? So it does not happen like this, and one should never ever torture them, oneself by comparing with others. It is absolutely a wrong thing. You are unique to yourself. You as a family is unique to yourself. Your case is unique to your case. So we have to talk about you and not others. And trust me, anybody who writes all these things are people who have been having a lot of negative outcomes, and they are trying to find an answer. People who have had success, they do not come and write all these things. So we have to, yeah. So what one sees on these social media platforms and tries to, put themselves into that other social media, that advice and the groups is absolutely not right, because it might not be that you are that case. You're absolutely different. So you should have confidence. You should have trust in your treating doctor. Please ask questions and try to get an answer for all the doubts you have. If your doubts have not been clear, please revert back to your doctor and ask 100 times and get the 100 answers, but go home assured and do not compare yourself with others. Yes.
As Doctor rightly said, please ask questions to the doctor, and family members or your friends or social media, they are not the right person to give you an answer. So I think this should be this you should follow this prime role when you visit a doctor. Okay, doctor. Next question. What is fertility wellness check? What does it involve?
So fertility wellness check, as the name implies, it is a check to make sure that we are well, we are good, right? And what is well is our fertility, all the things which is needed to get us pregnant. So if somebody is married and they have really started on their journey of of life, and they can always come and visit the doctor and just get tested. And what needs to be tested is a scan to just make sure that the uterus is okay, the ovaries has got good number of eggs, and then the husband can do a baseline test like sperm test, do some blood hormone test, and take advice from the doctor just to make sure that which all days, if they have intercourse, the chances of having a pregnancy would be maximum. So that's called a wellness check. So when we do this kind of check, and if any of these elements comes abnormal, like the thyroid is high, or if the scan looks like shows that the ovaries has got less number of eggs, that's when we tell that, listen, some things are not looking good. The scan shows very less number of eggs, so maybe you just try 3-4 months and then come back if you don't get pregnant. So what is happening is we are making them aware of the whole scenario that something is not looking great. So do not go back and waste time. And if everything looks good, go and try for 1 year. If nothing happens in 1 year, come back to us again. That is called a fertility wellness check.
Okay. Okay. Doctor, next question. What are the fertility treatment options available?
So fertility treatment options available would be classified into 3 different types. One would be once you come to the doctor for a wellness check, and if everything looks good, then they can advise a plain simple ovulation induction where some tablets can be given to initiate follicular maturation, means the egg development in the ovary, and give some medications to initiate ovulation, and advise the couple to have planned intercourse at home. Of course, giving some tablets and supplements. The second option would be to do an artificial insemination, which is otherwise called intrauterine insemination. The process is the same as the first one, which I told. It takes some medications to stimulate some egg development, and once the ovulation is detected, of course, they will have intercourse at home, but along with that, the husband will come to the clinic and the sample will be processed, and the processed washed semen sample will be inseminated inside the uterus. And again, some hormones will be prescribed to the woman, to take to think that it will support the pregnancy. And the last one bit would be to do in vitro fertilization treatment, which is otherwise called test tube baby treatment, as a general word, and that involves taking injections, scans, and then harvesting those eggs, making the embryos in the lab, and then replacing those embryos back into the uterus.
Okay. What are the fertility treatment options available?
So these are the 3 treatment options which I told you. One would be a plain ovulation induction, or artificial insemination, or the IVF program.
So there are no other. These are 3.
These are the 3 broad, and there are a lot of add-ons which we do. Add-on means something extra, like you can do a pre-implantation genetic screening. When we specifically do an IVF, we also advise our couples to go in for a genetic screening of the embryos to ensure that we are dealing with chromosomally normal embryos. And if we end up getting a chromosomally normal embryos, that's the one which we replace back into the uterus.
Okay. And when should... can you hear me?
Yes, I can.
When should couples seek help, and can any gynecologist also help them in IVF?
So IVF is a very super specialized treatment.
Because I think most of the people would like to know, like, if they go to normal gynecologist also, will they be able to find this? So I think that's a question.
So what happens is most of the patients, they end up going to the primary care physician, which are the gynecologists, and for an evaluation and checks. Yes, the gynecologists do the examinations and the checks, the hormonal test, the scans, the tubal test, the sperm test, and if they find any faults in any of those evaluation, like deficiencies in the hormones, deficiency in the egg number, or low sperm count, that's when they have to counsel the couple that it's better that you go to a fertility center, where the fertility doctor is going to take care of your fertility needs and devise a treatment option. Because IVF cannot be done in a gynecological OPD, in a gynecological setting. It has to be in a fertility center where you have an embryology lab, you have an operation theater, and so on and so forth. So yes, any kind of extensive fertility treatment has to be done in a fertility center.
Actually, this is a great information, because there are most of the people, they don't know about this. I think so, because they feel that even a normal gynecologist also can treat them in this. So I think, as you rightly put it across, I think many of them would realize that normal gynecologists cannot help them. Okay. And what is the cycle of IVF? Like, do you have any fixed cycle for this? And how many embryos are usually transferred?
All right. So IVF duration of IVF treatment lasts for an approximate duration of, let's say, around 15 to 17 days from the start of the cycle.
Okay.
So once we have decided that, okay, this lady needs a IVF treatment, so some injections are given starting from cycle day 2 after an initial scan and baseline hormonal test. Once those scans and hormonal test reports looks good, we start the injections, and these injections are continued for the next 10 to 12 days. The lady has to come into the clinic for regular scans to see the follicular development and also to do some hormonal tests. Once we have convinced ourselves that, okay, the follicular scans looks good and the follicle looks bigger in size and good in size, that's when we plan to do the egg harvesting. This egg harvesting technique is done under anesthesia, short general anesthesia, where all the eggs are aspirated out of the ovary. Once we get these eggs, then we culture those eggs in the lab by doing the inseminating the sperm inside the egg. What we say is the ICSI technique, intracytoplasmic sperm injection. And then we start culturing the embryos. And the embryos in today's day and time with advanced lab embryology laboratory techniques, we can culture these embryos till day 5 of embryo life. And once we have taken this embryo to day 5 of embryo life and we feel that embryo looks good, that's when this embryo is taken and gently replaced back inside the uterine cavity. And after that, we give some hormones for another 14 days. And after 14 days, we do the checks to know if the lady is pregnant or not. So if she is pregnant, then she is treated like any other pregnant lady. And in case the pregnancy test comes negative, then we stop all the hormones.
So in case if it turns negative, you'll go to second procedure?
Well, so if it fails, then we again have to have a sitting. Again, the discussion starts. Again, the counseling starts. We have to find out where exactly things have gone wrong. It's not that somebody comes, okay, come do the next cycle. It doesn't happen like that. We have to talk. Of course, we will be trying to do it because in one cycle the ovary gives that many number of eggs for us to work on. If we have not achieved that in one cycle, then we have to now go to the next cycle and start again fresh. Probably do things a little different, what we have not done in the first cycle, or we found that the first cycle some things were deficient and we need to address those issues. We will do those things differently and try to see that we end up getting a successful outcome.
And can they choose the gender of their baby, now this is done through IVF. So will their pregnancy be considered as a high risk?
Yes, I did not answer the second part of your first question. You had asked me how many embryos
are usually transferred.
Yes. So we usually have a strict policy of transferring a single embryo, one embryo at a time. If the criteria to be taken to know why we are doing one embryo transfer is that if the embryo is amazing quality, good quality embryo, and the endometrial lining is good, then one embryo should be transferred to minimize the risk of multiple pregnancy, because multiple pregnancy is itself a high risk pregnancy. So from a normal status with a single baby, which is a normal pregnancy, by putting 2 embryos and you have a higher chance of getting a multiple pregnancy, automatically become a high risk pregnancy. The risks and complications of having twins or triplets, we all know that the lady can end up with hypertensive disorders, diabetes, or nobody has predicted that preterm delivery will not happen. So why do we want to invite these complications and problems? So one baby at a time. But yes, we also do sometimes 2 embryo transfers. If somebody has not got pregnant in the first attempt or second attempt, then we go for a double embryo transfer at a later stage. The second question which you asked was gender selection. Yes. So yes, family balancing is the right word. It's possible in with IVF technique, and we can select why we can do the IVF and then screen the embryos by doing a 24 chromosome screening. And once we screen those embryos and we see there is a male baby embryo or a female baby embryo gender which is normal and euploid and chromosomally normal, and if the couple has a wish to replace a specific, then yes, we can go for the same embryo replacement with a specific gender.
But otherwise, will there be any special request for twins from the couple? Because some really wants twins. So
yes. So see, we as scientific people, we have the scientific information with us. The couple on the other side, they have a lot of requests and wishes. So we take those we take those requests and we try to explain them in a very scientific manner. Okay, it is our duty to guide them in the right direction, right? If somebody comes and says put 3 embryos, and if I put 3 embryos, and I'm not a doctor, I'm not a doctor at all. I'm a quack. So it is my duty to guide them and say that what is the importance of putting a single embryo and health-wise from the baby-wise. So at the end of the day, we all want a healthy mother and a healthy baby, right? So wishes are always there in our day-to-day practice. We usually get a lot of our couples saying that, oh no, let's put 2 embryos and we will have twins. We hear that, we discuss with them, and trust me, 9 out of 10 couples agree, said yes, you are right, let's go for 1, and they have ended up with a happy outcome. And because they did not go for the twin embryo, there was another embryo in the freezer. After 2 years, they came back and they put the second embryo and they completed their family from that group of embryos.
wow,
So
that's nice.
So it is quite a reassurance and a confidence to hear and note that I have an extra embryo in the freezer and I do not have to do IVF or any kind of fertility treatment again.
And now we have heard of test tube babies, surrogacy, and IVR, right? How they are different?
Well, test tube baby is the common word that is being used in the society, that I'm doing test tube baby, but actually it is the IVF treatment, right? IVF means in vitro fertilization, where we are fertilizing the gametes in the lab. In vivo
It's
means
one more
inside
way
the
of
body.
IVF.
Yes.
It's
So
one.
it is another way of IVF means doing it outside the body, and in vivo means doing it inside. So now when you ask me a question of surrogate is completely a different aspect. Surrogacy is hiring somebody's womb. All right. So if somebody's uterus is not right to carry a baby, or it has been damaged because of some infections or because of chemotherapy or radiotherapy or some kind of a problem, or by birth there is some kind of a malformation and this uterus cannot be used to nurture a pregnancy. So that's when a womb on hire, which is a surrogate, is surrogacy is done. But the baby which is growing in the surrogate womb is the biological baby of the couples, right?
Okay.
So surrogacy is basically asking a third lady, another lady, to carry the baby in her uterus. Once the baby is delivered, the baby comes back to the biological parents. Yes.
Okay, so it's a transformation of couples. This egg and this one, is it, in surrogacy? I thought. Okay.
Yes, so it is the couple will do their IVF, they will make the embryo, but this embryo is not put back in the wife's uterus because of some medical problem or surgical problem.
Okay.
It is put in another lady's uterus just for the sake of growing the baby.
Okay, and got it. Okay. So now, as and when we have discussed, one of my friends, she had conceived, but then, as you know, these days, like after 2.5, 3 months, when baby is supposed to get a heartbeat, but fetus fail to get a heartbeat. So is it because of lifestyle, or is it because normally what happens is they blame this poor lady who is carrying this fetus in her uterus. But then what exactly would be the reason? So if you could just tell that what exactly the reason is for their heartbeat failure in heartbeat. So like, really, I think, in audience also, they would like to know what goes wrong here.
So, loss of pregnancy in the early trimester, which we say is early miscarriage, is a very traumatic, scenario in a couple's life. It should not happen, but we have seen things happening. So, loss of a pregnancy in the early trimesters, like at 5 weeks, 6 weeks, 8 weeks, happens mostly due to chromosomal abnormality of the pregnancy. Means that there was some problem which happened during the embryogenesis, means during the formation of that embryo, there was some kind of a chromosomal, addition or deletion of those chromosomes that led to an abnormal conceptus. And though it implanted, but nature detected that it was not a healthy one, and it stopped it right there. And that is what we say is, missed abortion or early miscarriage. That is the foremost cause. There could be other causes also, like immune dysfunction in the mother's blood, like antiphospholipid antibody syndrome, or if there has been some undiagnosed polyps in the uterus, or if the man had some sperm DNA fragmentation in his sperms because of chronic smoking, alcohol, or any kind of pollutants, exposure to pollutants. So these are the lot of factors, but the first and foremost factor would be genetics. So going to work immediately after getting pregnant and traveling up and down, no, that's not the cause for miscarriage. Because if somebody has had a little spotting or bleeding in early pregnancy, and when they reach out to the doctor, that's when we say that yes, please go home and take rest. But if there is no complaint of any of this, bleeding or spotting, then we always advise our ladies to go back to work. And because going back to work will make sure that she is physically active, and that's good for her. So yes, I know in our society a lot of blame games are there, that you went to work,
Yes.
you did a lot of traveling, and that's why you lost the baby. No, no, we should do a lot of these conversations and see that this isn't the cause. There is something else. We need to evaluate that.
Please, viewers, and you can just go and tell your friends and family members also, this is not the reason, lady, it's not a reason, and it's not a reason even a lifestyle, busy lifestyle, or their work. It's only because of due to some scientific, some medical problems, as doctors said. So I think they should approach the doctor to know the reason, rather than just blaming a mother. So yes, now I'm going to, in case of multiple failure of IVF, do you suggest your patients to go to surrogacy or test tube babies?
Okay, so I will rephrase your question. So, due to multiple IVF failures, if somebody has not been able to get pregnant, then what do we do? Do we ask them to go for surrogacy or any other form of treatment? So, first and foremost, we have to sit down and first find and evaluate where things are going wrong. Is it that the eggs are not of good quality? Is it that the embryos are not of good quality? Is there any problem with the sperms? Is there a problem with the uterus? Is the lady's blood making some abnormal immune cells that is not letting the embryo stay in the body? So we have already 5 factors in front of us that I told you. And every 5 of these has a treatment option. So if we try to approach in this manner, then most of the time we do end up getting a successful outcome. Now let's refine our conversation. Now, if we see that a lady has not been producing good eggs and she is in what we say is premature ovarian failure, where she is absolutely not producing eggs, that's when we have to discuss and give them an option of third-party reproduction, like donor eggs.
Exactly.
Right.
So after all these steps, when you have seen, or when you've taken all these steps, then only you go to next suggestion.
We go to the next. We suggest and we say that it's better because we do not want to keep on trying again and again and again forever. we have to say that, okay, this is the next level of options that you have had, and if it is okay between you guys, means between the husband and the wife, to take it to the next level, then yes, we give them the options. Yes.
Okay. Doctor, this is your personal experience. Do you remember any case that seemed to be impossible, but you could treat them and treat them successfully with the a happy result?
Veena, yes, that brings a smile to my face. Today afternoon at 2 p.m., I got my WhatsApp message from one of my, patients with a beautiful picture of the baby. Now, this couple
Oh,
was a young couple, in their early 30s, at 29, 30, and she had a condition called polycystic ovarian syndrome, PCOD. And we did few cycles, did not happen, and then we did IVF, and then we kept on transferring one embryo at a time, and first time transferred negative, second time transferred positive, but ended up in a miscarriage, third time transfer negative, and the fourth time transfer again positive. It was very haphazard, and this took us to the second round of an IVF cycle, where we did a genetic screening. Then we were like, okay, let's do a genetic testing of these embryos, because sometimes when embryos are abnormal and genetically abnormal, they do not implant, or they do this early miscarriage. So we tested the embryos, and we had few normal embryos, and because she had multiple attempts of transfer and implantation failure, so this time we decided to put two embryos and see how it is. And in the first attempt, she got pregnant. Okay, she was very happy and good. And out of that, one embryo implanted. And as of today, she has delivered a beautiful baby girl. And this whole process took us 1.5 years. 1.5 years. And there were times when the patient had lost their hope, and there were times when they were very stressed out, and they were very upset. They didn't know what to do. And when you are stressed and you are upset, you talk so many things. You
yes,
don't know
yes.
what you're doing. You try to take impulsive decisions, so many things. And we were there persisting, counseling and guiding them. And we were available to them 24/7. When I say 24/7, means not that we come in the morning, 9 o'clock, go home at 5 o'clock, close doors. No, we were
Anytime, round the clock.
we were interacting with WhatsApp, we were interacting on phone. Okay, doctor, I'm having this problem in the middle of the night. Yes, do this, do that. And today they say that thank you for the patience, thank you for the understanding, and thank you for your amazing support and the guidance, counseling, and education, and the brilliant work.
Oh, lovely.
This is the success story. We had negatives for 1 year, but today we have a success story to tell. And like this, we have a lot of other examples. I've had a lady, who was in her 10th year of marriage, and she came to me suggested by some other friend, and then she came and said that, my doctors in my country were treating me only for my abnormal menstrual cycle by giving me treatment and hormones just to regularize my menses, saying that if my menstrual cycles are regular and treated, then I'll get a baby. So when she came to me, I was not talking about her menses at all. I was more into the fertility aspects of it, because I told her that, if I approach from the fertility aspect, you will get a baby and your menses also will get treated.
Oh, okay.
You understand? So we did a treatment, and she ended up getting twins. And she said that what you did in 30 days, my doctors out there did not do in 10 years. And if I would have persisted with my other, doctors, then I would have been infertile throughout my life, and everybody would have blamed me that, you are not able to get a baby. And today, see, things are so. And she got a boy and a girl, and her family is complete.
That's it.
So these are the good things. This makes
That's
us.
the reason I asked you. Normal gynecology, can they help them out? That was a question when I asked you earlier. Maybe should have gone to a gynecologist who couldn't help her, like to know what exactly was the reason. So maybe they would be treating her for other reason altogether. So
Here in our country, in Dubai, I'm saying our country because I stay here, so it is the place I stay. So here we have a very transparent approaches with our clients and with the doctors. So us, the gynecologists and the patients, we work as a team. So the gynecologist, they call us and say that this is a patient, who has this. We tell them what to do, and guide them. And then if not, then send them back to us. So it all works in a nice cooperation way. So yes, there are certain times that gynecologists can do it, and they are doing it amazingly good. And there is a time when these couples have to be sent to a fertility center for higher fertility care and treatment.
And what is PGS, and what is PGS, by the way?
PGS stands for pre-implantation genetic screening, which I have mentioned before. It is the screening of those embryos to ensure that they are chromosomally normal. And only when they are chromosomally normal, we replace those embryos back. So it's basically segregating the normal embryos from the abnormal embryos.
Okay. Okay. Doctor, can this regular yoga or good lifestyle avoid infertility?
I
think, this might be running in a lot of people's mind. Like, if we have regular, lifestyle, will that be helpful?
We always approach this problem of infertility in a very holistic manner. Exercise, physical activity is so important, not only for couples who are planning to get pregnant, but for all of us. All right, because it rectifies our health, it rectifies the metabolism, it keeps our weight in check, and it helps us not to get blood pressure and diabetes. And when we do exercise, there is a release of the feel-good hormone called endorphins from the brain, and that makes us more happy, and that takes stress factor. So the mental part of the thing is also taken care of. So now somebody might ask, what kind of exercise should I do? Should I do yoga? Should I do high intensity? And I have a lot of ladies who say that, my instructor is asking me to do high intensity for fertility. We usually do not get into this specific aspects of high intensity, low intensity. You want to do yoga, you want to do Pilates, you want to do aerobics, you want to do treadmill, you want to do yoga, you want to do meditation, mindfulness, do something, but please do. And that is true for both husband and wife. So physical activity, yes, and yes, everybody has to do it. And that it will cure infertility, no, but it will help you in reaching your goal. Yes.
Doctor, we have really given a lot of information, helpful information, and I just wanted to know, like, if we have left out, if I have left out asking something, if you want to tell audience, you can, you're free to tell, like, no?
So what happens, which we want to say and spread in the society, the message is that time is of essence. Time is of essence. Infertility is on the rise because of so many factors. People are getting delaying their marriage, delaying their childbearing because of so many factors. It's their personal choice. But
Yes.
always keep it in mind that unlike a man, a woman's ovaries are time bound. It's all the eggs that she has been ever born with, and every menstrual cycle there will be a depletion of these eggs and follicles. So if 6 months or 1 year you have been trying and you have not achieved, do not hesitate to reach out to fertility evaluation and treatment. And if there is any sign that your ovary is on the decline, means the eggs are on the decline and the ovaries are small in size and not too many eggs, please try to do something, but either in the form of artificial insemination or IVF, because 6 months, 1 year, 2 years down the lane, what chance you have today will not be there tomorrow. So so time is of essence, and this is a very strong message, because as fertility physician, we get to see this quite commonly. And then the request is that do something, please get some eggs. Understand that this is a physiological change in the ovary. We cannot get these eggs back. But the thing is that whatever eggs are there, we have to make use of it and get a baby ASAP, as soon as possible. So yes, this is the small thing which this appears small, but it is a big message to the community that do not waste time and reach out at the right time to your doctor.
Okay, Doctor, it was really nice having you here, and a lot of information you have shared. I'm sure it is helpful for all our viewers, as well as their family, as well as their family, friends, and friends. Kindly spread this message, spread this voice. I'm sure that you would have got a lot of information from Dr. Partha. And in case if there is a delay in conceiving, kindly approach right person, right doctors. It's not all the not the gynecologist may not be able to do something which these doctors can do who are into this profession. So please do approach, and there's no hesitation, there's no shy, there's nothing. You have to approach the right person for this. So, as rightly doctor said, beyond hopes, beyond belief, your journey with us. So, stay smile and try for your smile on your face, and these people will make it successful. So, doctor, thank you so much. Thank you so much for being in the show and taking your precious time from your busy schedule. I know you're very busy. You just came from your OT. So thank you so much, and I'm sure all the audience are also thankful to you. Thank you so much, Doctor.
Thank you so much. Thank you for your time, and it is a great platform to sit and discuss and spread the information of how right treatment at the right time can get a lot of success and complete a lot of families. So yes, thank you so much, and all of you
Thank
stay safe.
thank you, Doctor.
Bye bye.